Thank you so much. It's an honor to be here, and thank you to Cynthia for inviting me for this esteemed panel. So the title of my talk is Don't Just Say Anything. I'll do it this way so I can talk and see. Keys to Success in Refractive IOL Informed Consent. Okay. These are my disclosures, none of which are relevant to the current presentation. And this is my legal disclaimer, so now you know I'm a real attorney. I'm an MD-JD, and obviously if you've got any legal stuff, you should follow the advice and get your own attorney. But I'm here today to help you review some of the best practices for obtaining informed consent and identify some key points in providing informed consent for refractive IOLs. Okay, so we're in an era where the importance of what we say is paramount now more than ever, right? I mean, this is a little tongue-in-cheek joke, but the truth of the matter is that what we're saying it means a lot to our patients, in particular in regard to when you're talking about advanced technology or premium IOLs. The original title for this talk was kind of based on a parody of words from the film Say Anything, which at the time I thought was filmed in New York City. That turns out it's not true, but it was too late for me to change the title of my talk by the time I figured this out. So don't worry, I have instead saved it with a famous quote from this movie where the main character, played by John Cusack, says that he's looking for a dare to be great situation. And so that's what I would encourage you to think about when you're providing your informed consent for premium lenses. This is your opportunity to have a dare to be great situation. And it's key for you to do this to be able to have the most success for your patients and preparing them with informed consent. It is a process. The informed consent is more than simply getting the patient to sign that written document form. You have to include the indications for the procedure as well as documentation of all of the risks, benefits, and alternatives to surgery, as well as things like consequences for delaying or refusing treatment if they're not going to have an advanced technology lens, astigmatism, presbyopia correction, that type of stuff. And the patient and all involved in the discussion are in agreement with the plan and understand why the surgery is being performed. And then you want to make sure in your chart that the patient has a signed procedure-specific consent form. There have been cases that have been litigated with OMIC that just have the consent form from the hospital instead of that procedure-specific consent form that you should be discussing with the patient and having signed in your office that shows that this was a process that you went through with the patient for them to be able to fully understand the decision that they were making to go through with surgery. All right, so I'm going to move forward to talking specifically now. Those are just some of the basics about informed consent itself. And now I'm going to talk to you about some of the stuff in relation to particular premium IOLs. So OMIC claims data on premium IOLs. This is actually the only published data that they have right now. It's from 2011, so this was their first initial 34 cases that they had of litigation on premium IOLs. I have spoken with OMIC recently. It continues to be a low source of claims for OMIC, but they have a lot of questions on the confidential hotline from surgeons calling in about premium IOLs. So I'm going to highlight to you what some of the from some of the data that was publicly available before, and then some of the things I've discussed with them. When they first published this data, they showed primary and secondary causes of premium IOL claims, and they divided them into where the claims came from. So clinical, the physician, the system-based, or the patient. And you can see the highest number was under system, and if you were to guess what 11 of those 20 claims came from, it would probably be a good guess to be the title of my talk. So they were on informed consent. So what are some pearls that we can think about when we're discussing in particular informed consent with premium lens patients? So the first thing is to identify, evaluate, disclose, and document the presence of systemic or ocular comorbidities that could impact the quality of visual outcome. You have a diabetic patient who wants to get a lens. You have a patient who has any kind of other ocular You have to tell the patient, and you want to make sure that you've explained it to them and that you document that you explain this in their chart. And actually what I do on my written consent form, if there's a specific risk factor that that patient has that's going to possibly affect their outcome, I write that in there, and I will initial it, and I will have the patient initial it. You also want to educate about areas of clinical uncertainty. If you've got a patient, we have all patients now who've had cataract surgery maybe on one eye 4 years ago. They have a monofocal there, now they want a multifocal in the other eye. You think that patient is a good candidate, you've had that discussion, you want to make sure you document in the chart that you have that discussion, that you have the patient-specific consent form, and that you make that clear. One of the things from my discussions with OMIC, what they had said was that when you want to discuss with the patient about premium lenses, you have to tell them and make explicit what the goal of surgery is, what the goal of this lens is. If there's a lens that's recently approved, you want to let the patients know we don't have long-term outcome data, there's possibility of unforeseen complications, but what we have thus far, everything looks good, or data from Europe, things look good, etc. But you want to inform them about areas of clinical uncertainty. Other things, you set expectations on the performance of the lens, clarify that no guarantees can be made. My mentor from UC Davis, Ivan Schwab, would say guarantees come with refrigerators and stoves, not eyes. I find myself quoting him a lot nowadays. Prepare them for unexpected occurrences. What will happen if the selected lens cannot be placed during surgery? What are the alternatives that will happen? And then going to help the patient through any problems that may arise. And that was another thing that OMIC has identified, that you're empathetic with the patient and that you intervene at the earliest opportunity and let them know that you're going to help them through this process and help identify any concerns or address any concerns that they may have. All right, so in conclusion, this is your opportunity to dare to be great in informed consent discussions on premium lenses. Don't just quote unquote say anything. You want to be methodical, considerate, and complete in your communication. Make sure that you document patient-specific communication and that you include a signed, procedure-specific informed consent in your chart.